I'm setting this up for Jim. Hold on. Can you hear me?
I can hear you.
All right. So, because I have an appointment at 9, so I'm going to just make sure that you got him. All right. There you go, honey. We shouldn't have to do anything else. There you are.
My computer guru is leaving for a moment.
Good morning, Jim. How are you?
Good.
Survived all the gray day yesterday?
Yes.
What's that?
Want to know if you survived the gray day yesterday?
Oh, yeah. Just a little rain.
A lot of rain off and on. Yeah, just wet.
All right, honey. I'll see you.
All right. Take care.
All right.
Did you get all 4 sets of meetings, Dr. Marble? Meeting minutes?
Yes, I did.
Okay, great. Terrific.
They looked all right to me.
Yeah, I think they're okay.
Yeah. Is Dr. Tam going to be able to join us this morning?
I believe so.
I don't think he is.
Oh, really? Good. All right. Well, I'm sorry to hear that, but
Because I think we're in a little trouble. I saw him the other night, and he said that the hospitalizations were up where they were in June.
yeah, I've heard the same thing. Paul is going to join us. I know that. So
Yeah. So I don't think we've turned the corner.
well, I think we may have turned another corner. That's the issue.
As our esteemed chief has said,
Yes.
we've turned the corner.
Yeah.
Doesn't look that way to me.
Depends on what corner we're looking at.
Yeah.
But, you know, I don't know whether you've been following what's going on in Europe or not, but Europe is really a mess.
Well, yeah.
I understand Ireland last Thursday adopted a lockdown that people are only allowed to go 5 kilometers from their house until the 1st of December.
Well, in France, they've imposed curfews.
Yeah. And Italy's bordering on the same. The UK has the same kinds of issues too. So.
And Europe's been a couple weeks ahead of us if you look at the beginning. So I hope that's not.
Yeah.
Well, now the United Kingdom is injecting people with the virus so that.
Right. I don't know.
That'll help their numbers.
Oh, that'll help the numbers for sure. You know, Delaware's revised how they're counting people are getting tested, which will probably make some bit of difference in our numbers. But yesterday, on the NBC Evening News yesterday, they said that 40 states have now had rising numbers.
Mm-hmm.
Right. And we've gone from 5.5 to 6.9% positive. So that's not good.
We're going the wrong direction.
I don't know what else we can do.
Well, this morning on NPR, I heard a comment about, you know, they're blaming some of this on what they're calling corona fatigue, that people are just tired of the shutdown and so they're just doing whatever they want to do anyway.
But I read an interesting statistic yesterday, though, that if 95% of the people wore a mask, it would save 130,000 lives by the end of February.
Yeah, I saw that yesterday too.
Yeah, and if 85%, it would save 96,000.
Right.
So there's part of your answer.
Right. And then somebody else was making a comment this morning that it's nothing more than a virus, just like the cold. So we're just going to have to get over it. And I'm like, I don't think so.
I guess the governor still has that suit against him, man.
I believe so, yeah.
He's being dictatorial.
Yeah. Well, one of the members of the House last week made a comment that he thought that the governor should not be able to issue an executive order with in terms of phase 2 more than 2 consecutive months without the approval of the legislature.
Huh.
I saw that.
And he's now done it 7 consecutive months. So this particular legislator was very upset that, you know, it had been reissued. I don't see that changing.
I mean, it's not, that seems arbitrary because
Yeah.
the reality is the emergency is very much with us.
Right. Right.
Well, we're certainly not going uphill.
I mean, the legislature, if they wanted to get involved, could definitely, they could convene a special session.
They could have brought that up when they met before the end of June.
Right.
Okay, we still need Paul. There's Dr. Cowan. Good.
Hey, Paul.
Good morning. Paul, you're muted.
Oh,
Hello,
and Dr.
Dr.
Tam is here. I thought Dr. Tam wasn't going to be able to make it.
Great. We lost Paul, though.
Morning.
Hello, Dr. Tam. How are you?
Fine, sir. How are you?
Good, thank you. There he is. Back again. Perfect. Okay.
Good morning.
Good morning.
Morning.
I say good morning.
Good morning, Susan.
Good to have you back, Susan.
Oh, yeah.
Okay. Well, it is 9 o'clock and we are all here, I believe. Hello, Nancy. How are you?
Fine, thanks. A little confusion over which format we were using. Sorry about that.
No problem. So it looks like we're all here. Dr. Cowan, thank you very much. Dr. Tam, thank you very much for joining us. I think we could, if you would, we could call the meeting to order. And we have 4 sets of meeting minutes that we need to approve. Hopefully all of you got them. I know they were very late getting out. And Paul, I know you were not part of any of those meeting minutes. So, but hopefully it gave you an idea of what we've been covering in the past.
I read them over.
I didn't. I was away.
All right.
It's up to you, Dr. Marvel.
I beg your pardon?
I said it's up to Dr. Marvel to approve them.
All right, well, let's go ahead and, is there a motion to approve these meeting minutes as they are? I know Paul.
I'll move.
Thank you.
Second.
Okay, all in favor?
Aye.
Now I'd like to turn this meeting over to Dr. Cowan if I could. Obviously, as a new chair, I want you to, whatever we can do to help you feel more comfortable, but clearly the interest here is what's going on statewide, whatever you can share, and what's going on locally at the hospital would be most valuable to us.
Sure. First, thanks for having me. I thought for those of you that don't know much about me, I'd just give you a quick history, 30 seconds. So I'm originally from Smyrna, so I'm very much a Delaware-centric person. Before I was a physician, I was a paramedic in Kent County. And I've been an emergency medicine physician. I've been here in Lewis since 2002. It's kind of ironic that I'm following Dr. Marvel. Jim has been a mentor of mine since actually I was a paramedic. So we've worked closely through the years, especially with the trauma program at Beebe. So I'm happy to follow him and happy to help here. In addition, I work full-time as an emergency physician. I'm also serve on the board of Beebe, and I'm also one of the county EMS medical directors. So I have my hands in a bunch of different pots. So that's kind of where my perspective comes from. So with regards to COVID, and Dr. Tam, feel free to interrupt me at any time. I would say that the the status of COVID in the state and in Sussex County is somewhat of a mixed bag to report since the last time we met. The number of COVID cases continues to, the positive cases are still a little over 5%, close to a little above 6%. That is not a significant increase in the number, but certainly not a decrease. So kind of it is what it is. And that number's been kind of hovering around there mostly through the summer. What we saw change towards the end of the summer was the number of hospitalizations in the state. The good news is, since we last met in early October, the number of hospitalizations in the state has been relatively stable. The bad news is that the number of hospitalizations in Sussex County has increased in that time. And actually the number of hospitalizations in Newcastle County has somewhat decreased. So we've become a little bit more of a hotspot. The counterbalance to that is, over the last week or so, the rate of rise of new admissions here in the county. So the number of new people that we're adding to the hospital each day of COVID seems to have somewhat leveled off. So although we have more COVID people than what we did, more COVID people admitted to the hospital now than what we did a month ago, the daily rate of rise is not nearly as large as it was, say 2 weeks ago. 2 weeks ago, Dr. Tam and I were holding our breath every day, kind of anxiously looking at the numbers, afraid of what we were seeing with daily increases, and we've not seen that, which is good news, I guess. The problem with COVID people in the hospital, as you may or may not know, is that hospitalization tends to be rather longer than a lot of admissions. So somebody comes to the hospital, is admitted for COVID, they tend to be in the hospital for 5, 7, 10, 12 days, as opposed to somebody who's in for a day or two. So they're somewhat labor intensive. Currently, with regards to BB, our total number of COVID people is maybe about 25% of what it was at its maximum in the spring. So just to give you a perspective, it's not nearly as bad as it was in the spring, but it certainly is significantly more than what it was in, say, the end of the summer. So certainly it's a mixed bag as you look at stuff. The other thing that I'll caution you as you look at this data is, and I like to make the analogy to the stock market. You know, it's very difficult on any given day to look at the stock market and try and figure out why there's been movement. It's too much of a myopic view, and you can look at daily COVID numbers and you can, it's difficult to answer the question of why something's happening. And part of that is just the vagaries of testing and looking at single days. It's easier when you look at weeks or months. So that's kind of my take, which is sort of a mixed bag of COVID. We're still seeing it. It's still certainly very much of a concern in the community. So is there any questions on that? Or David, do you have anything else you'd like to add?
Yeah, Dr. Cowan, I think you were pretty good about identifying the key issues. You know, I know that everybody wants to hear what the hospitalization rates are like here, and as well as at different places. And we continue to monitor that closely. But I think the key here is that our rate of hospitalization, the number of people hospitalized here over the last 2-3 weeks have been relatively stable. And I think that's good. I think, as Dr. Cowan said, that 3 weeks ago when we hit a number that was of more concern to us, we were really watching to see if it would go up, just like it did back in the springtime when it had a high rate of increase, and it has not done so. We continue to monitor that every day. And that's one of the reasons why publicly I want to make sure that you all know that we have been continuing to do everything possible to ensure that people are safe, both patients as well as staff here in the hospital, recognizing that as we go into the flu season, people come in who are sick, not just because of COVID, but because of flu, as well as other kinds of strokes, heart attacks, all those other things. And we want to make sure that we do not end up in a situation like the beginning of this with the first phase, where we had to actually consider closing and did close down our elective procedures. We don't want to do that this time around. We recognize the impact of that on the community, and we do not want to do that. And so that's why we've had a change in our visitor policy to ensure that we minimize the risk of people coming into the hospital who are infected, and we don't know that, and making sure that we maintain a supply of PPE and that we have the capacity to take care of patients. But as of right now, we have plenty of capacity to take care of patients. And so we are good as we look every single day as to what is going on here in our part of Sussex County.
Has there been any, can you offer any information in terms of demographics? I think some states are reporting that they're seeing more younger patients. Is that true of the mix here at BV or not?
Yes, so we are seeing some younger patients, younger being less than 50. I hate to say it that way. It makes me feel a little old, but
welcome to the club.
You know, the demographic are such that there are some younger people. And I think that's one of the key issues. The majority are still of an older population. To some extent reflects our population here in Sussex County and certainly amongst us in the coastal towns. But I think that it's important also to just share with you that one of the things that we're not seeing yet, and I hope we don't, is an increase in our significant morbidity or mortality rates. In other words, people are still coming in, people are still getting sick, but partially A, because it's a younger population demographically, and also B, because we now know more about how to treat patients with COVID-19 as compared to the beginning. You know, when everybody got put on a ventilator and kind of just, what do we do? Now there are protocols, and you know, Bill Chazanov, our infectious disease medical director, has been really good about applying all the latest advances, remdesivir, which, as you may or may not know, was fully federally approved today, still is on a protocol-driven approach in terms of how you give it, but it has been fully approved by the FDA, I understand, effective today. That people aren't as sick as they were. They're not on ventilators as much. And so that's another reason why we continue to have a good capacity in the hospital, because not everybody got put on a ventilator and put in the ICU right away. And that's, of course, as many of you know, is the rate limiting process that concerns us, that we didn't want to bottleneck and get in a place where our critical care capacity was full. So we are doing better in terms one that and taking care of patients.
Good, thank you.
We do have a couple of messages here in the chat. One question from Bonnie Osler is, can area hospitals please release hospitalizations by range, such as 0 to 15, 15 to 30? This will give the public better information on this important health care metric.
You know, I think we can do that. As you know, from the very beginning, as I've shared with you, we have an agreement with the state government, with the governor's office, as well as all the hospitals in the area, to not have specific information coming out of our hospitals, that we work through the state public information offices. That said, I will be speaking with the governor and the public health team, because I think more and more people are asking that question. And so a range might be, Bonnie, a good thing that we can present to you as we move forward. So please stay tuned as I ask if this is something that we want to do in partnership with the government.
Okay, thank you. And then the next question we have is from Trina Brown Hicks. I've been reading that reporting data to the government site has been difficult, and that states and the data may not be accurate. Can you speak to this, and if you're aware of any issues?
Yeah, the federal government's reporting structure is a little convoluted, but we have not had trouble with it. Some other hospitals and health systems throughout the country have. But I think we have done a pretty good job here in Delaware. Please also know that everything that you see on the Delaware website, the state website, is not through the federal government. It's actually through the Division of Public Health. All the reporting, all the positive tests actually go directly to them. And so that's a pretty accurate result of all the testing that we do. And of course, all our hospitalization numbers go directly to them as well. So it is not something that's filtered by any other agency. It is something, especially on that website, that goes directly to the Division of Public Health. And so it's probably the best source of information that you have on an ongoing basis. It's what I look at every morning when I first open my eyes and wake up and see what happened over the last 24 hours.
But you know, you make a really good point. And this goes back to my comments about how closely you look at the data. This is a good reason why you should look at data more on a weekly basis than in daily, because there are vagaries with reporting. For instance, there could be a slowdown with a Sunday with regards to the number of tests that are performed or the number of tests that are reports or that are reported. And that can give you skewed data on a Monday versus a Tuesday, which is why you see some of those changes within a week that really aren't statistically significant. So, so I'd encourage you to sort of step back and look at things, certainly within a week. All of those sort of reporting issues sort of work themselves out. But I think looking any closer than that probably will not be helpful for you.
Okay. One other question. I know the governor's mentioned that he's how they're reporting the number of people getting tested is being recalculated. Is that going to you think that's going to change our rate of infection reporting? And I think the understanding I had was that if someone was getting tested over multiple weeks, that they were only being reported once. Is that correct? And now we're going to be reporting everyone who gets tested.
Yeah.
So if you
go ahead, Dr.
Go ahead. So if you go to the state website, they actually report both numbers now.
Okay.
It's actually on the same toggle that I have on my computer right now, but they have both the total number of people that have been positive and the total number of tests that have been positive. So
I haven't looked at it, so thank you.
Yeah. So, and I think the reason why that change occurred is they wanted to create reporting that was really consistent across states.
Right.
And the total number of positive tests is more consistent. We've been reporting the total number of people that have been consistent.
Great. Thank you.
Positive. Yep.
Thanks. And is there any uptake on tracing? Is anybody doing anything seriously with tracing? I know there was discussion at the governor's office about that. Are you all instituting any kind of tracing or gathering information about tracing from patients?
David, do you want to handle that?
Sure. So there are two kinds of tracing, of course. Everybody who is positive gets contact tracing. So that is something that is all handled through the Division of Public Health in the state. I think they've been doing a pretty good job. You know, we've asked them to come and take a look when we have had a slight increase in our hospitalization numbers to see if there's any connection, and there really hasn't been in terms of any recent, outbreak or anything like that here in Sussex County that we would then share with you. We do contact trace our own people if people do come out as positive, because staff are staff and they are out in the community, and they also get sometimes come in contact with people who are positive. It's not just because of the hospital and being in contact with somebody here in the hospital. And so we do that on a regular basis, and our employee health team is very robust in terms of how we track and make sure that we keep people safe, and that staff, are monitored if they are positive or negative.
Great, thank you. Nancy, do you have any questions? You frequently have questions about tracing. Are you okay with the information we've gotten so far?
My understanding, at least nationwide, is that it's not been a success, that people are not cooperating and not answering the calls. But I don't know whether that's true in Delaware or not.
I think that anecdotally in the summertime, I heard some people from the state saying they had difficulty tracing people, but I haven't heard much of that recently. Certainly, our tracing within the organization has been very successful. I would say that overall, it seems as though COVID now, the people that we're seeing, it's across a broad spectrum of the community. It's much harder to find a common thread. In the spring here, certainly at least in Sussex County, a great number of the people that were exposed to COVID had some sort of connection to the poultry industry. And then we saw another significant component of people that had recent travel to an area in the country that was much more endemic than here. And now it seems like it's kind of spread much more through the community. So the good news is here in this corner of the state, we have not seen an increase in COVID hospitalizations from our long care nursing facilities. There have been a couple facilities in Newcastle County that have seen an increase in that, but we haven't seen it here. So.
We have another question in the chat. Some schools have been shut down recently. I know Woodbridge in particular has been shut down for 2 weeks. How are we doing in the Cape Henlopen School District?
So my understanding is that Cape Henlopen has been doing very well, that they continue to have, people who are in the system. As you know, we were very active with the Know Before You Go campaign, where students got tested prior to going into the school year. And then as they go through, they do their screenings and they monitor. My understanding is that there has not been a lot of positives as compared to potentially other places where they've identified outbreaks. It's something that they watch every single day. I will tell you that the other thing is just, I've worked with Bob Fulton at the Cape Henlopen School District, and they are doing a really good job of monitoring the safety protocols of the 3 W's: wash your hands, wear a mask, and watch your distance. I think so far so good. BB Healthcare has been working closely with the school district. We hope to have some more opportunities for surveillance testing with them, working with the state, and that's something that we continue to work towards because we just feel that it's so important to be part of that. We have our wellness centers there, as well as BB Healthcare supports wellness centers at the schools, and they've been also seeing a really a good opportunity to work with mental health and other issues as kids kind of go through the pandemic on their own and their own pandemic fatigue. But I'll tell you, as a father of a football player, they've done a really good job of making sure that all kids, even when they're playing, are wearing their masks, which I think is an incredible thing. And so I think even the athletics department is doing a fantastic job of doing everything they can to balance, if you will, the safety with doing what's right for the kids.
I'm going to sound like a broken record, but I again ask if you're meeting with Dr. Fulton to remind him that the community needs to know what's going on, not just the parents and the kids and the faculty. I'd only heard of one positive case, so obviously I'm out of the loop if there've been more than that. I think that's important for the community to know so they can judge how much they need to restrict themselves, particularly our older people who don't have a connection to the school. And as far as I can tell, they're not doing that at all.
You mean communicating with the public?
Correct.
All right. Well, certainly I will be happy to share that with Bob. We may actually talk a little bit about, we actually had a town hall with parents as well as with the school nurses. So I will check with him. As you know, he has a board that he works with. I've met with some of the board members. They're all very supportive of the community. They're just trying to balance it out. So Nancy, I will share that information with them.
Yeah, these people are all going to the grocery store. They're going to the places that I go to. And I would like to know what's happening at the school. I think it's a potential, I'm delighted if they're really, really paying attention, and I take your word on that. But the athletics, just the fact that they're in school, I think the community needs to know what's going on.
We have a question in the chat from Chandler Parr from WRDE. He said, is it possible to estimate the number of cases we could possibly see during the winter? If not, how are you preparing for a possible influx in this area?
So, Dr. Cowan, do you want me to take that, or how would you like me to do that?
No, I
think It's a great question. And that is probably the difference between what Dr. Cowan says, where, you know, you don't check the numbers every day because it doesn't do you as a community member anything good. It's like that stock market analogy. While I guess maybe I'm a day trader using that analogy. And so I do check the numbers every day just to look for any potential trends. So Chandler, I think we are working again with Johns Hopkins and some other academic institutions to look at modeling. We have a lot more data now about, you know, what the potential is. If you remember during the first phase or the first surge, there were a lot of models that showed, you know, when the peak would be and things like that. So we've asked again to re-engage that effort. Some of the data is now different, so it's not a model like it was before in some respects because of the age of the people involved, as well as the fact that back then we were entering spring months, when now we're entering winter months where people are more, you know, indoors, people are more congregated. We're entering a time of year when there's Thanksgiving and Christmas. So the model is different, but we are working on that. Regardless of that, what we are doing here at BB Healthcare is, I think, I don't know if it's a good thing to say, but we are planning for the worst and hoping for the best. And so we continue to be very conservative in our estimates to make sure that we have the right amount of PPE, that we have the correct amount of PPE, that we have our staffing capabilities up and running, that we are doing everything we can to continue to protect the hospital as well as the clinics and making them as safe as possible with all the safety precautions, the cleaning precautions that may not have existed to that level back at the beginning of the pandemic. Because our goal is to, in this case, stay open while we continue to deal with the pandemic. Of course, we'll have to watch and monitor on a regular basis to see what happens. But you know, we have done everything we can to be safe and to have good quality of care in protection of people. We have the testing capabilities that we didn't have before, so that as people come in now for their colonoscopies or surgical procedures or other things like that, that we actually test them before their procedure to make sure that they are safe, that they're not going to have any illness or problem as a result of being COVID. And of course, to protect staff because they may require intubation or other kinds of ventilatory support, you know, when they're getting their procedure. So Chandler, to answer your question, we monitor this very closely. And we're just looking for the model that working with Johns Hopkins and UPenn and University of Delaware. But at the end of the day, we're doing everything we can to really make sure that we can deal with this if it goes up to a very high number.
Are we considering this the second surge, or do we feel that that's yet to come?
Dr. Marvel? Go ahead, Dr. Cowan.
Yeah, I think it's sort of anybody's guess. You know, the initial modeling suggested that the peak for COVID patients was going to be in the middle of the summer. That's data from the spring, and then in the summer we had none, and then we've seen this spike now. So quite frankly, we're not sure. As David said, you know, we are preparing for the worst and hoping for the best. The fact that hospitalizations over the last week or two have not dramatically increased is a huge positive. I don't think you can take anything more out of it than it's just good news right now. Certainly could change at any time. We know that, but I am admittedly very concerned about the holidays. You know, as an emergency physician, one of the things that I always do is I look at the CDC has an interactive site for influenza every year. And then at this time of year, you'll see influenza activity in the state or in the country is listed as sporadic, and you'll see very small kind of hot spots. Then after Thanksgiving, you'll see those hot spots get a little redder and a little larger. And then by the time it's Christmas and into the new year, then influenza becomes endemic in the country. And that's typically thought to be from kind of the traveling and the mixing that goes on. So I am anxious about that. I'm anxious about the crossover between influenza and coronavirus, just from a management standpoint. So we kind of have to wait and see, but we're certainly prepared. We're cautiously optimistic, but prepared is a good way to describe it.
Right.
Dr. Marvel, if I could just follow up real quick on what Dr. Cowan said, I think I'd like to thank the community for really doing everything possible to get vaccinated for the flu. That is one of the things, whether there is a new COVID surge or not, or second COVID surge or not, the issue was, of course, to make sure that people did not have the flu and get sick from the flu, and then also get COVID infection because they're already at a higher level of morbidity, they're sicker, it makes them more likely to actually end up being hospitalized with the COVID. And so I think it's a really great thing. It's a double-edged sword for me when I hear that we've done such a good job with vaccinating people and are vaccinated 48 to be running out. It means that everybody has been getting the flu vaccine. We vaccinated more people. We're at about 80% of last year's complete vaccination capacity. In other words, if you took last year's flu vaccine season, we're already at 80% of the flu vaccines used, and we still have more time to go. Now, one of the things we've done just for the public, if they're listening, is we have a flu hotline that you can go on our website. And one of the things I've asked our staff is to do a flu hotline where we are going to find out where a flu vaccine can be gotten, regardless of whether it's a BB site or not. We have taken it sort of from, if you remember Miracle on 34th Street, where Macy's said, we'll just tell you wherever you want to get whatever you need. And we're going to do that. We're checking with our Walgreens, our CVS's, our Lorette partners, VA, to ask about their flu vaccine levels so that we can make sure that you all get the flu vaccine as best as we can get it to you, regardless of who. And it's not a competition here. We all want to make sure that everybody gets vaccinated. So thank you very much to the community for really responding and getting your flu vaccines.
Thank you and your entire staff for making them so available. It's really been a very helpful program. Thank you. I know a lot of people who've gone to clinics, various places, so that's terrific. Thank you.
Mr. Mayor, is there a sense of compliance within the community or fatigue in terms of the restaurants, the stores, the beaches? Or
restaurants
are we doing okay?
Restaurants are doing a pretty good job of trying to make sure that people stay masked until they get seated at the table. I think there is frustration, and a fatigue factor is definitely real on the streets. In terms of, I see people walking, on 2nd Street or on Front Street with their masks sort of pulled down below their nose. And but by and large, I think it's pretty good compliance, but it certainly could be greatly improved.
I think the major thing that we need to watch out for now is complacency.
Exactly.
Because if we let our guard down, then we're going to have a bad situation. And we have not turned the corner. I don't care what our chief executive says, it's not turned yet.
Yeah, no.
So there's a good possibility that the increase in infections that we've seen over the last month may actually be a great reminder for people in the community that they now know somebody who has COVID or had an exposure, or they potentially came in contact with somebody and had a high risk exposure. So maybe what we've seen over this month will be a little bit of a wake up call for more broader swath of the community. So I'm kind of hopeful with that.
Yeah. We hope so.
We haven't driven Route 1. DelDOT's got a lot of signage up, reader board signs up saying, encouraging people to wear masks.
Yeah.
All the way, I was in Wilmington over the weekend, and there's several signs as you go north.
So there's another question in the chat from Trina Brown Hicks. Is PPE masks available for those who find it costly to purchase? And she's talking about disposable masks.
I'm assuming that Ms. Brown Hicks is asking if we have available to the community PPE. I think that at this point we do not. as we're not resellers of PPE, and we are monitoring. Our goal here is, of course, to keep the hospital ready for any problems in the future. And so we are actually taking care and making sure that we have the PPE stocks. I think that if there's a specific concern, then please, we need to know about it from somebody, and they can, of course, reach out to me, because the regular community member out in the community should not necessarily need PPE unless they are somebody who is a close contact, taking care of a loved one who may actually have the COVID vaccine, the COVID virus, the COVID infection. And I think those are considerations that we certainly would be happy to support. But, when I'm out in the community, when I'm out walking, I still my cloth mask that I have. And that's what scientifically is, been shown to be beneficial, whether it's here or whether it's in Europe or whether it's in Asia with respect to that kind of masking. So if there's a specific concern that Trina has, please don't hesitate to let me know so we can figure out how to support you.
There also is the organization that has been put together to help with COVID, and we can connect with Trina and give her that contact information. So if she knows of someone who's in a position where they need help, I think we can get information to her.
Yep.
And I wanted to ask, is there anything we can do to support the city's approach to the COVID crisis at this point in time?
I think you're doing it by, making sure you and your friends are wearing masks and doing everything and avoiding large gatherings. Particularly, stay within your circle of friends who you feel comfortable with. I think that's the best thing you can do right now. I know when we have the ambassadors downtown, we've had them back out a little bit. They've been reminding people to wear masks, and some people are very appreciative and they put them up, and other people just say no. There was a piece on NBC News last night where some woman got very belligerent with like a 7-Eleven type store, and there's, you're not going to go anywhere with that.
One other question I had received before the meeting was, are you seeing one of the things that I guess earlier on, and maybe they're still saying it, what was considered a high risk activity was using gyms and things like that. Are we seeing cases in the community that are associated with people going to the gyms?
We're not. If you look on the state website, there's an area where they talk with about the suspected exposures for people, and gyms are, although on the list, sort of towards the bottom of the list. Quite frankly, my own experience is I attend a gym in Rehoboth, and if I think about the social distancing aspect of it, I look and everybody has a mask on. But just by the nature of a gym, most people tend to be sort of away from each other also. So you kind of have a mask and you have more of that 6 foot distancing. There is no doubt though that the best thing that you can do if you're looking to make yourself safe is to be not in a conditioned space. Like the more time you can spend outside, if you're going to be around people, but clearly the safer it is than being in a conditioned space. But the short answer is I'm unaware of any data that specifically says that gyms are a really high risk as long as the appropriate measures are being taken.
Yeah, that's a good segue to the reopening plan. I think everyone's aware, we have canceled Trick or Treat for this weekend, and we've also canceled Hospitality Night and the Christmas Parade, and the idea of trying to get people to stay within their groups and not gather in large groups where they might be exposed. In terms of other ideas for reopening, either Paul or Dr. Tam, do you have anything that you would recommend that we consider at this point?
Well, I think from a public health standpoint, we can't tell you that the data suggests that we are there's a dramatic decrease in the virus in the community, which is, I think, probably what you would like to hear. Mm-hmm. So I think in that setting, it's difficult You certainly, I guess you can encourage activities that are at low risk, certainly things that are outside, but that's challenging this time of year as it gets colder. And even when people are outside, they tend to be huddled together now this time of year. So I think it's difficult. I think from a public health standpoint, as unpopular as those decisions were, that's probably was the safest thing for the community, even though it's frustrating for people. But from a safety standpoint, I think unfortunately, you made the correct decision. Those are some of my favorite events in Lewis by far. But David, do you have any other comments on that?
Well, I was looking forward to all those.
Next year.
There you go. But I think Dr. Cowan is absolutely right. We need to do everything we can as a community. And actually, I think it's really important because now more than ever, this is our community. We don't have a lot of people coming in and going out and coming in and going out, which was our concern, if you recall, early on. And so we really do have some ability as a community to keep that curve down, to keep it flat. And I think that's a critical thing for us. So as much as I have pandemic fatigue, as much as I wish we could have those events, I think the right thing to do is what the mayor and the council have talked about, which is to keep us closed as much as possible. I think the other thing I would say on the other flip side is that one of the reasons why I want to make sure that we continue to maintain our hospital's capacity is that we've had a significant reduction in the number of people coming to our walk-in clinics, coming into our emergency rooms. And I think people are afraid. And so it is a balance that I ask help with from the Board of Health and the city to say, but at the same time, if you are feeling the symptoms of a stroke or a heart attack, or if you have pain, don't wait. We have done everything we can to be safe and to be clean in our emergency rooms to protect patients and staff. And we want you to come in because we don't want you to get so sick that you have problems as a result of just waiting for your care. So please, we need to spread that message around as well, that the health system is here and the health system is robust and ready to care for people.
As a telehealth for behavioral health issues picked up a lot? Have you seen a big uptick in that? Amen.
Yes, anecdotally speaking, and I'm sure Dr. Cowan can speak more to it as somebody who's on the front lines, but we just had our BB Goes Purple events for last month, and we're already at a point where we're going to surpass last year here in Sussex County for opioid problems coming into the emergency rooms, overdoses. We've been very careful and very diligent about our Narcan program of distributing Narcan, and they've all been going out very quickly. So I think people are concerned as well. We are continuing to work hard with the state to make sure that we work on telepsych services. It's one of the things that we pushed the state government on and asked them to help us allow people from out of state to still be able to provide telepsych services for people here in Delaware, because we can't just wait for the next round of residents to graduate from their programs to take care of people here, especially when psychiatric or psychologic counseling is something that can be done well, definitely proven in the medical journals that can be done well using a telephone or teleconferencing capability. So we are working actively on that as well.
Thank you. Let's see, we have a question about swimming pool. Is a swimming pool a risk? I think, would you like to comment on that?
What do you think, Dr. Cowan?
About an indoor pool?
Yeah.
Yeah, so I think it's an indoor space. So I think there's certainly the risk there that there would be in any other conditioned space. So I think that it's tough to, certainly I can't imagine swimming with a mask on. So it would be difficult unless it's really well ventilated. It would seem like a high risk activity to me.
Okay. Thank you. Okay. In terms of other recommendations that you all would have for the city and the city council to consider, do you have other recommendations that you think we could do or we should be doing at this point?
You can improve parking. No, I'm just kidding.
We're working on that.
I know. You must hear that 10 times a day. David, do you have any comments on that?
You know, I think that Mayor Becker has done an amazing job of balancing out really healthcare issues with other issues. You know, for us, as I think I've shared with you before, the social determinants of health, like economic health, homelessness, food insecurity, you know, unemployment, are actually critical in how we address healthcare issues. That's balanced by, of course, the pandemic. And so, you know, I'm grateful for the mayor in always thinking about what the right thing to do is, you know, and I think we need to continue doing that. I will just finish off by saying once again that we really boil down to always doing the 3 W's, right? Wear a mask, watch your distance, and wash your hands. And I think we just need to continue doing that on a regular basis. I would encourage, maybe we just have to think a little bit, Ted, about, you know, how to develop, you know, the venues where we can do some things that allow for people to get the social aspect, if you will, of getting together without the physical distancing of getting together, the physical aspect of getting together. That's a challenge, especially in the wintertime when, you know, you want to talk with your family and things like that. But how do we help, especially our elders and our seniors, get the opportunity to connect with friends and family while, you know, being in a different setting? We are happy to work with you on that as well.
Thank you. Okay. All right. Any other questions, either from those of us who are on the screen or those of us in the audience? If not, I would suggest we look at the next date. We've been trying to do this about every 3 weeks. That puts us about the 16th of November. Does that work for you all, or that week anyway? Dr. Tam and Dr. Cowan, I think your schedules are probably the tightest.
What date did you say, Ted?
The week of the 16th, Monday the 16th.
Works for me.
David, what's your schedule like on the morning of the 17th or 18th? I'm available both days.
17th is better for me, but
17th is better for me.
As Dr. Cowan and Anne Marie know, I do not control my schedule whatsoever.
We can coordinate then.
So I'll talk to Lynn then and get your schedule clear for you.
Okay.
I'm just checking to see if she's put anything down for the 16th or 17th. Obviously, I'm not out of town or anything like that with everything going on. So clearly, I think 16th and 17th, we can make it work, especially if it's at this time. I could so I have some medical staff kind of meetings earlier than this, but I think I'm fine with 9 o'clock on those days.
Okay.
So Mr. Bard, Mayor Becker, can we go with the 17th at 9 a.m.?
That's fine with me. Okay.
Perfect.
Works for me.
Terrific.
Great.
Hey.
Terrific. Well, thank you all for being here this morning. I think it was a very good conversation and a good discussion about where we are. So, Paul, thank you very much for all your insight. And Dr. Tam, thank you again for your insight and all the things the hospital are doing to keep us informed. I think the coordination between what you're doing at the state level through the governor's panel and everything is really helping to keep this community very much in the forefront. And we appreciate that. Thank you.
Yep. Great.
Okay.
All right. Thank you.
Thank you. Have a good day.
Okay. Yep.
Good
See you.
day.
Thank you.
Stay safe.
You too.
Bye.
Bye.
Goodbye.